Hello, friends. A very good day to all of you out there. A very, very warm welcome from the entire team of Mrcpi tutors. Thank you so much for joining. Is my voice audible and clear to all of you out there? Hello, can you all hear me? Hi, good to see you, Suparna. Thank you so much. Hi, Peter. Hi, Sobia. Hi, Mariam. How's everybody doing? Hi, Raghav. Radhya, Swad. I wanted to meet you guys before having the throttle preparation because I know many of you have taken the change after MRCOG doing MRCPI, and I know that you have got lots of questions. Why are we taking MRCPI? What is different in MRCPI? What are those things that has to be learned differently? How we are going to manage our studies? How the live sessions are going to be? So I thought that it's better to meet you guys before you start with your daily agendas in the study group. So how's everybody doing? Morning, morning. I have 5 people. Just give me 1 second, guys. Just 2 minutes. All right. So people in the waiting room, I hope you've added Sobia. Yes, the team has added them already. Okay. Nagwa. Hello, Mubashra. The voice is audible. Hello, Sarah. How are you doing today? Good morning, Peter. Yes, I can see you in the session. Thank you so much. Thank you. All right. One more welcome. Thank you very much, Mariam. I hope you're doing great. Okay. So before we start, let me know that what are the concerns and the questions in your mind. What are those things which made you go to MRCPI? Why are we taking MRCPI, by the way? What is the reason of taking MRCPI? What is the reason that you guys have started having this study pattern? Thank you very much, Mariam. Sarah, good to have you here. Sarah, why are we taking MRCPI, sweetheart? Do you feel that it's better than MRCOG, is it? Oh my, Nasreen says I'm taking this because it's better than easy than MRCOG. So many students, they have this thought in mind. Any other thought other than being easy? So are you guys starting with the mindset that because it's easy, thank you very much, Radhya, nice to meet you as well. So other than being easy, some other thought in mind? Anybody is taking MRCPI other than the fact that in comparison to MRCOG, it is easier?
Maybe
Any
I will be able to get it once I pass Mrcpi. Maybe it will help me to pass the part 3 also. Help me to study better.
That's
And
also good
additional
because we are adding on information, Suparna, right? Yeah, we are
yes.
adding on knowledge. That's really nice. And also, it helps you have the GMC. I mean, with the same pathway, you can work in UK and Ireland, right? It can give you registration. That's also a very positive point. So I'm sure that everybody has known the details behind that. This time we are starting the course around 25 days earlier. Generally, we start for 3 months, but this time because the gap, because of the mock exams in April, is going to be more. So I've decided to stretch the schedule a little. That's the reason that I'm meeting you guys earlier for the introduction because the April is going to be and the May is going to be packed with the mock exams back to back. So it's going to be tough to have the live sessions more. I thought that I'll give you the idea about the starting up of MRCPI. What do I expect from you guys? How we are going to start up the studies? What's needed? Thank you very much, Swat. So good to see you, my dear. So Sarah Kiani wants IMC registration. You can get IMC, you can get GMC. Both of them are possible, Sarah. Things are going to be perfect. It's just that we need to clear this exam. All right, so why are we taking MRCPI written, friends? How to prepare for the MRCPI Part 2 written. If at all we say that this is a very easy exam, then why students, they still tend to fail this exam is a big question. I do not say that we have got 100% passing. We are still waiting for the March result on 4th of April. It's going to be declared. So we are still waiting for that. That would give us another idea that how did the college respond? Do students that do fail, why they fail, we're going to touch those points and how can we pass in one go. I'm sure that every student's question is that we want to pass in one go. We want to clear this exam in one go. What is going to be the course outline? How I'm going to differ as an MRCOG tutor. Comparison to that, how I'm going to be different is MRCPI tutor. I will tell you that how things are. Just to encourage you guys, we don't have March 25 results as of now. September 2024 was spectacular results. You all have to be part of it. Let's see and let's check. All right, so we've got a question here. Is the time now is enough? It's absolutely enough, Honor. The time which we have at the moment is sufficient for MRCPI. We don't need more than that for September exam. We can't study for a year for MRCPI. But yes, every student is different. The student who has had grip over the Green Top guidelines and for MRCOT or for any other specialization exam, if you have done any specialization, definitely your understanding or your grip over the written part is a little more, is a little better. So the ones who are taking MRCP as the first specialization exam, then of course, they have to put in a little more effort. But if you've done your local degrees for your country, you have read obstetrics and gynecology yourself, you stand better, you stand stronger. All right. Sobia Huck says, is it possible to get AMC registration after MRCP? Unfortunately, no. We do not get any AMC registration even after MRCOG. That's a bigger, comparatively to MRCP, that's definitely a bigger degree. But the thing is that you get pathways. You get pathways, your standing is better. You always have to pass Australian Medical Cancer. So, Sobia, if you intend to shift there, I can get you connected to RFA alumni, students who have taken that pathway, how they've done their specialization, but that will be just after MRCP. Okay, you can let me know. I'll tell you about those who have passed through those pathway and they're working there after all these specializations. All right, okay. Now let's go ahead to the first step, that why are we doing MRCPI? Now, when we have our obs and gynae with us in terms of education, in terms of guidelines, in terms of practice, right? We should know that RCOG is worldwide recognized, but RCPI is not less than that, right? So we have all those benefits which we get from MRCOG because MRCPI, that is the Royal College of Obstetrics and Gynecology of Ireland, is a qualification that's recognized by General Medical Council in UK as well. Of course, as Sarah was saying that she wants IMC, that's okay, but GMC is also permissible and you can work. Now, you guys ask me, I've got many students who are working in UK after MRCPI, and then after that, they find difficulty. The mommy don't stand at that point. I mean, there's a little difference. Of course, there is not going to be an equality between an obstetrician who is RCPR and an obstetrician who is MRCOG, right? But definitely it gives you a direction. It gives you an entry. Many of you require a pathway. You require an entryway that, okay, we can get GMC registered, at least we can be there. Spouses are there, family needs to be shifted. You have lots of reasons for that. So you get a direction to go there and start your work. You're eligible to start your work. So it was back 2 years, 3 years back when the GMC was started, and it was the RCPI president, Professor Mary Hogan. He claimed, and I quote, that this is a significant development that widens the training and employment opportunities for doctors who have achieved our postgraduate qualification. Our college has always had strong links and excellent collaborative relationships with our colleagues in UK. And this is further recognition of the high esteem that our membership exams are held in as a mark of attaining high quality medical training, Professor Hogan, I unquote. From this day till now, I can talk about RFA alumni. There's so many candidates, so many alumni members. They have been shifted to UK after MRCPI. Few of them were stuck up in MRCOG. We know that it's tougher. Few of them couldn't do that because it's a vast study. And few of them they had to do early, so they took a shorter or a faster pathway because they had to reach out to the family and they have to start work. Nobody actually thinks of having a break in the work even after doing the specialization. So they're happy, they're contented. And if you go to the alumni group, you can have so many examples there who are working there. Many of them are in London even, and they are satisfied because they have achieved their goal in just like 1 year time, written and OSCE back to back, right? So knowing the aim clearly is that first step that you should know. Talking about the Gulf countries, you can have a specialization, you can have a specialist license working in Oman, Dubai, Abu Dhabi, Sharjah, Qatar, Doha, all these places. You are definitely better than those who don't have any international specialization from UK or Ireland, right? So coming back to the exam format, I know that there is something in the air that RCPI is easier. You can do that even if you're not able to do RCOG. This is a very common concept which I see in students. I agree. So many times students are stuck up in RCOG, but they're able to do RCPI. Now, I won't say that we don't have to study. I won't say that it's something where you would take it easy. We would definitely study harder because exam is an exam, but the paper pattern is comparatively easier. I mean, if you ask me after MRCOG, just in, I think, 21 days, and I still remember back in 2018, I performed Hajj in that year as well. I just came back, and after 21 days was my RCPI, but I was very fresh with RCOG information. So that was the reason. When you have content in your mind, then you just need this much time, right? So we have one paper here, right? Only one, 100 single best answers. No extended match questions, which is the biggest relief for the students. We do not have Sobia Haq. We do not have any negative marking. So you can do it easily. Single best answers means that you are going to have question. After that question, you will have 5 options for that, right? So the question A, B, C, D, and E. 5 options are going to be there. After reading the questions, you will select out of that, and it's all in your home. It's all online so far, right? So when we talk about MRCPI, it is 3 hours and 100 single best answers. Generally, time is never a problem. Can you imagine on the March exam, almost, I think 20-30 minutes before everybody started ringing, ma'am done, ma'am done, ma'am done. And I always tell them strictly, please keep on sitting there. It's okay, you've got 3 hours. So generally time is never an issue. And Suparna, we don't have those long questions generally, other than 4 to 5 out of 100, guys. Note it down today. 4 to 5 out of 100 would be long questions, and that too only labor module. That's it. Other than that, we do not have the big scenarios which we are fighting for the time, like that of an EMQs, like that of an MRCOG. We do not have any negative marking. We do not have any extended match questions. 100 single best answers are to be done, and that is to at your comfort place. You know, that feel of anxiety of going to the exam center, no matter how much we know about the exam, I mean, the stress is there. So MRCOG is 50 single best answers, 50 EMQs in each paper, and we have two papers. It's a very exhaustive exam. You need to be so calm and composed, especially for the second paper. And you have to reach out to a Pearson Center. You have all the Green Top guidelines, nice talk articles. It is very important that you practice time management there. When we talk about MRCPI, only 100 single best answers in a single paper. One paper is there, so it's not exhaustive at all. And it is at your place. It's online exam on an application test reach. I've got all the details of the test reach when we will do half of the course. After that, I'll tell you what test reach is, how we're going to practice the single best answer, how you're going to flag the questions. I've got a tutorial for that. I will show you that tutorial. You'll work on this. And somewhere from today, note it down. All my students from today, after around 2 months' time, somewhere at the end of July, I want you guys to start practicing online single best answers. So many of you just take out a book and you start um, doing the single best answers from the book, right? You pick up Brian McGowan, you pick up Amanda Jones. That's okay. That's good for practice. But last 45 days, I want you to be on screen and do the questions on the screen. I will guide you on that. Even the books you solve in the group, I want you to open up the desktop or the laptop or the MacBook and do it there. Last 45 days, screen practice has to be there just to have an idea, because this exam is not on paper for you guys. All right. When we took our exams, we did on paper, we had pen, but for you guys, because it is on the screen, so we need to get adaptive to reading on the screen and, picking up the lines there, being fast on the screen. So many students, when they don't practice, they start having headache, they start having watery eyes. This should not be there. All right. So not for now, but just by end of July, I want you to be like on test reach. We will work on the mock exams. We'll work on certain things. What is the content? You have Irish guidelines most priority as compared to Green Top guidelines. Green Top guidelines here is second priority. Okay, right? Nice is the third priority, talks is the fourth priority. So here, of course, 70% of the curriculum is Green Top guideline. Here, we have 70% of the curriculum Irish guideline. This is the first major difference. Now, the question which I get is that, ma'am, we have done GTGs. Shall we do the same topics from our CPI, from Irish guideline? So when I take session, from the first slide of my session, I always tell that this has to be covered from Irish guideline. And if you have done, for that matter, VBAC, vaginal birth after cesarean section from Green Top guideline, it's okay. Just take out the same notes and read from the same, because there's no difference. But when differences are there, then we have to cover up from our CPI. Am I clear? Got it, everybody? Understood? So these are the basic things. Any questions so far? I'm sure that you guys have lots of things, because after that, I'll be meeting you guys with gaps. The moderators would be there. If anything you people have in mind for your preparation, for the comparison, for anything, I am here to guide today just before your main schedule starts. Wanted to meet you guys so that we are on the right track from day one. Right? Yes? Any questions so far? Did you guys understand the comparison in the paper pattern? Did you guys understand that how the paper pattern is, how we are going to do, and what are the components of the exam? Exam would be in test reach, but many students, they have internet issues in different parts. My Sudani student, Simon Ajam, good to see you, my love. My Sudani students, often when the internet connectivity is not very good, Sobia, they can go to the internet cafes. You can always take some business centers or internet cafes, because those 3 hours, we need a very good internet. Okay, all right, Mubashir, that's great. Okay, so from today, you guys will start doing your entry requirements. I'm sure that now, because you are in Mrcpi written group, and all those who have joined from the open group, please, when we have Mrcpi, you are eligible to take part 2 written if you have a qualification of Mrcpi part 1, either in general medicine or pediatrics. and it has to be in 6 years, the result. So many students form our RFA general medicine. They always ask that we have done this, now can we take obs and gynae? Answer is yes. If you are MRCPI part 1 written exam you have done in general medicine or pediatrics, you can take MRCPI part 2 gynac, okay? Or if you have MRCOT part 1 done, then you're also exempted for the part 1, you can take directly written. If you've got Australian qualification, New Zealand, South Africa, Pakistan, you've got the Malaysian qualification, you all are eligible to take direct part 2 written, but then you should have results available with you. It's not that you write in the form. When we have the opening of the form, we just add on the results, and because of that, they would see the eligibility. So first step is that whatever is your prerequisite to appear in MRCPI written, you guys would do the scanning of the documents of your results, and they should be ready for the uploading. Am I clear? If anybody is FCPS, if anybody is MRCOT1, if anybody is having any qualification which makes them eligible to take MRCPI 2 written, you guys have absolutely SOBIA. So you should have the result with you saying that yes, you are eligible. Am I clear? Everybody clear? Because it has to be uploaded. All right, that has to be attached. Okay, great. Thank you very much. Now, in the entry criteria, you should know that I need an experience certificate from your working place that should be completed 18 months. Now, so many students ask me that I am a specialist working at my place since 2019. So I have my certificate for the working experience. I have a suggestion. They won't do any sort of a problem if it's a long term, but whatever it is, it should be, preferably it should be recent. So from now you guys can work on this. Firstly, you'll get the results. Second thing about eligibility, because so many students, they got emails after 2 months, after 1.5 months that your entry criteria is not eligible. So then they're in a fix, all time gets wasted. And I've got emails for the candidates saying that this certificate is not proper, this is not proper, and then they give you 2 days to cover it up, otherwise your application gets not get into the qualifying for the exam entry, right? And this is a fix. So from today, before starting, I don't want a hassle in the end. I want that from today you guys are very clear about the arrangements that you have to do. If you are working long term at some place, it's absolutely okay. That is something which is appreciated, but make a certificate that is recent. I mean, from 2 months back. So it is a month of April, right? Now we are starting up. So like somewhere in the end of the April, you should be able to take the certificate, or even March is okay. But it shouldn't be like last year, last year, especially when you're currently working, right? Okay. So Mariam, I'll have to see the result, right? It's, what is that? Is it the same diploma as Arab Sobia Haq? DGO. Sarah Kiani, absolutely. Absolutely. You have to give the training certificate or the hospital where you're working, Sarah. It has to be there. There's a complete form where they want your assessment to be available there. All right, okay. So please make sure that 18 months, but recent. 18 months should not be 2022-23. They won't say anything, but I want that if you are currently working, why don't we do the recent thing? Do you guys understand what I'm trying to say? So recent one, for example, Suparna, from your hospital, you'll take a recent certificate, which would cover the last 2-3 years, even if it goes back till 2021 and 2018. But starting date from the back should be 2025. Sarah, you're understanding what I'm trying to say? Sarah Kyani, you understand? FCPS training in Georgia jail. No. So are you working now, Mubashra?
Absolutely. I don't know if I can unmute myself. I'm sorry.
Absolutely.
I have completed my
unmute,
training in.
Yes, Sarah.
Hello, Dr. Sidra. Actually,
my
I
dear.
completed my training in 2017, but my post fellowship was completed in 2022, I think so. So
Okay.
I am
You're
currently
working now, right?
currently I am doing my own clinic. So
So,
what should I?
so anybody who is HR, anybody who is responsible for the clinic will sign. So many students, they get their husband's signature, but they are in the administration, you know. So I mean to say from your own that you're currently working till date, get a certificate going back. And as the supportive documents, 2022, that fellowship and all that you can attach. But don't show that you're currently not in practice. Do you get what I mean? Right? Get for the
So
current
HR
thing
is
and
managed
then
by
support. Yes,
okay,
Sarah.
HR is managed by my husband, so I will get a certificate or
Absolutely. You
my
get
own
from HR
hospital signed
department
by.
on the clinic letterhead with the that logo, whatever. I mean, official letterhead, get that from the HR, whosoever is responsible. Okay, but that should be recent. It should
Okay.
cover recent, and then as supportive, join 2022 one as well, 2017 as well. Supportive documents should be there. That it shows like it's going as a story. Okay, like you know, there has been like this is the pathway the candidate has passed. But if you show 2022 and you don't give the current one, then there is a question that maybe you're at home. Got it? So that should not be an impression when it's not. Got it? Okay, everybody clear? Did
Okay.
you?
Yes.
Yes, and you all can get your documents checked by me and by the moderator before doing uploading, because I don't want these emails coming up. It's very stressful getting an email that you don't fit in. We have this query, we have that. So now we should try to fulfill all the criteria. All right, absolutely, Sobia. Consultant certificate is fine with their stamp and their license number. All right. If you're working in a private clinic, Mubashra, definitely the private clinic can give you the experience that you're working at the moment in gynec and ops. And it has to be written gynec and ops. It has to be that, you know, practicing as, if not gynecology, you're having the training or you're having the clinic as gynec patients you're seeing. So the lines, you can just check it and it should be from recent. That's my concern. All right. So 2024, what are you doing after 2024, 2025, Mubashra? Add it, please. Okay. Now, up till now, they've not changed the online thing. It started in COVID, guys, but up till now, they have announced again it's going to be remote. And until unless they're not changing, because we took exam before COVID and it was on the paper and it was with the center. So after COVID, still they are doing remote invigilation. This suits many of you. It saves you from traveling hassle, cost of course, right? So exam date which we are heading towards is Thursday, 4th of September 2025. This is remote invigilation, and the opening date you all have to notice is Wednesday, 11th of June 2025. Okay, 11th of June 2025. With this 11th of June 2025, I want that April, May. 11th of May, I am giving you deadline. We have got a complete month of April. Please get all the documents ready. What are the documents? I'll give you the list. One, I've told you about your result. Second, about the experience certificate. Okay, got it? Why? Because it is not only documents preparation, then you have to make it PDF and then you have to make scanned copies and put it on your desktop on the screen in front of you guys, right? Now, another misconception in students is that it's okay, ma'am, it's 11th of June starting and it's still 16th of July. It's all right. We've got lots of time. We'll start preparing on 11th of June and we will do till 16th of July. They say that it's not first come, first serve. We evaluate as per they have their own system. But I always say that if you have the opening date, why do you want to go to the end date, please? Okay, so I want all the moderators, coordinators, everybody is on the group at that time. I want that you guys have it ready. And first 1 hour of opening up of the applications, you are the one to just send your application. Okay, there should not be any delay because we are preparing now, right? Why should we having a delay? We have time. It's just March ending. You've got April, you've got May, and these things slowly, if you just start preparing now, you don't have a difficulty in that. Am I clear? Please mark on your calendars 11th of June for uploading the application data. Mark it today, and 11th of May from my side to get it checked, because if any mistakes or if anything would be changed, so we have 11th May to 11th of June time to get to the departments and settle that. Am I clear? Right? Everybody clear? That I'm giving you 1.5 months to settle your documents. Radia, please, my dear, you raised your hand. Yes, please. Yes, Radia, you want to say something? Your
Hello,
hand is...
hello, Dr. Sidra.
Yes, my dear.
If I take this exam before, but I
Mm.
did not pass, anything required from me? Any
Okay.
document again I should upload?
Yeah. So what happens is that you've got your registration number, right? When you log into that, on the left side of the screen, your scanned documents are still coming up. So whatever you were doing, you can still have this, like, for example, your Mrcpi 1 result and your experience would be there. And if you were eligible once to take the exam, that means that they've already verified your documents. Correct? But one thing which I would like you to do is that how early it was the exam, you're going to do the experience, you can enhance and you can take it current as well. So if editable options come here, you can give the recent experience as well. That's one thing which you can do. Okay. All right. But other than that, everything has been verified. How much is the gap between the previous attempt and this attempt? That matters. But generally, it's coming up. One more thing. Few of the students last time, they had technical error and they didn't see the folders. If you can't see the previous scanned document in your number, so you should be ready with the same folder, my dear. Whatever you prepared earlier. Do you get it? If it is visible on that day, it's okay. If it's not visible, at least you have them ready to upload. You got it?
Yeah.
Okay, great. Thank you very much. Then you all want to clear it as early as possible. So after your September attempt, you will have 2026 OSCEs for you guys, right? So they've not announced as of now what is going to be 2026 February, but if it's going to be Dubai or Abu Dhabi, whatever it would be, you should be aiming to pass your written in September and aiming to appear in February or May 2026 to clear this Mrcpi, right? Earlier, you should plan it because written part is very fresh in your mind and you can go ahead with the next step. Am I clear? Got it, everybody? Yes? Now comes a very important point where students, 80% of the students, they make mistake is testimonial form. So Parna, write in the group and tell moderator to give you testimonial form today. You can download from the IRIS site as well. The testimonial form is Royal College of Physicians of Ireland testimonial form, which is indirectly your verification. I know students, I know where you're working. Mrcpi doesn't know. They have to verify that you are a doctor, and there are 2 individuals who are actually verifying that you are known to them, right? This form, you have to take a printout and please get it with pen. It has to be written. So many times you guys do typing and you just make a signature. You have to write here, for example, there's one known person, doctor, this name, address of the hospital can be there with their license number I need. Please. They are GMC, they are anything they're working in, Gulf, every doctor has got their practicing license number. It should be here. Then doctor number 2, here, it has to be very clear that whatever you're writing here should not be enjoining. It should be, for example, it's SEMA, right? It has to be in the block capitals, right? And make sure that you write the address. We don't need home address. Working place address is fine, wherever they are working, and then their license number to work. If it's their DHA license number, if it's their GMC license number, that has to be written here. And here would be your name. The name of the candidate to be entered by either the referees can enter or you can enter. For example, it is Nasreen. Abdullah. All right. Okay. In blocks. So many times it's written, it's block, you don't read it, and you do in joining, and the testimonial form comes back. But the problem is it won't come back immediately. Absolutely, Sophia, PMDC would work. Absolutely. The problem is, when would it come back? Guys, it would come back after 16th of July. When the closing date of the application happens, after closing, 1 month they take, and somewhere in August, you will get an email that your testimonial form has this problem. And then exam is just 1.5 or 1 month away. When people, they get acceptance, you get the email if at all there's some problem in the documents. So the time is very less at that point because they start doing the verification after the closing date. So that's why please make sure that you don't have any problem in the uploading of the documents, okay? And then referee 1 signature, the doctor who was here will put a signature here with the date. Referee 2 signature, this is the second one, this is the first one, is going to put the signature here with the date. All right, okay. So you're going to put the dates here, and this form, then after filling up, you're going to scan. Why? Because you're not going to give any physical document to the RCPI. You will scan it and you will put it on the documents which you have to upload. When you open up on the date of the opening of the application, you will have a place on the column on the left side, upload the testimonial form. You'll go to the desktop, upload, and it will go there. Got it? Everybody, did you guys understand about the testimonial form? It's a very important form. If your testimonial form is strong, of course, the chances of application that becomes like verifying very fastly, okay? Waiting list generally is less now. They've increased the seats, but still there are little, my dear Adya. But now comparatively less. Comparatively, now people are getting seats faster, okay? Now,
Dr. Sidra, one small question.
yes, please, my dear, yes.
Sorry to disturb you.
No, no.
Since
Yeah.
we are working, some of us are working in the peripheries in Saudi, and the
I
main hospital is away. So, do we need to take the experience certificate from where we are working, and the signatures on the testimonial from the consultant in the main hospital? Because we do not have consultants in our hospital. Or is
Yeah.
it the OB/GYN specialists who are Egyptians or other board exams? Is it okay that way?
Are you talking about the experience certificate or are you talking about the testimonial?
Both. Can you tell me what to do? Because testimonial should.
For experience certificate, hospital administration can give. Experience is
Okay.
not must by the obstetrician. And
Okay.
regarding the testimonial form, everyone, it is not must that the doctor is obs/gyn.
Okay, ma'am. Thank you
It
so
can
much.
be anybody. It can be GP. It can be any doctor, dermatologist. It can be any doctor who knows you. So many times people, they do it from their, family members that, okay, yes, I have this in this hospital. And it's not from your workplace. Testimonial form is not from your workplace. It can be anywhere. Who is a doctor and who knows you, who verifies that, yes, I know that this doctor is this, and they can have their workplace. So it is your just, you can say, like, at times when we fill the bank documents, they do links, they just need a few of the people who know you, and they just want to know that, okay, yes, this is something just to verify. Got it, everybody? This testimonial is not has to be your hospital. So Parna, you can take anybody.
Okay,
Like
ma'am.
your friend, you can take from Atya, you can take from anybody. I mean to say somebody who knows you, who can be who can verify you. Got it? Okay.
Yes, ma'am.
Everybody
Thank you.
understood? Saima, Sara, Ani understood? Radhya? Okay, great. Now the list of the documents, please note it down. You need to have an attested copy of your primary medical degree, which makes you a doctor. Attested copy means attestation can be by any lawyer, because there are so many things in Ireland. They've got Garda, they've got attestation bodies. So a recent color passport style photo, 100 into 100 pixels. When they say recent, please, it shouldn't be more than 1 year gap. I mean, it should be identified to you, right? It should be a recent one. A copy of your part 1 or equivalent qualification, I've already mentioned, and a testimonial form signed by 2 referees. So it's so easy. Your medical college degree, your passport size picture, and the degree that makes you qualified for doing the part 2 written, and the testimonial form, which I've already showed. These should be attested copies for the primary medical degree, all right? So attestation makes it show that, yes, you are from this medical school and you have done this medicine from this school, all right? So these things should be scanned and it should be ready because you need to upload the scanned copies. So the first step is make the copies ready, then scan them and put it on your desktop as a ready section, all right? Okay.
Only the degree, right, ma'am? The MBBS
Only-
degree. No need for the MRCOG Part 1 to be attested again.
So it's better that you get it attested because otherwise it is a number for each. But to make it better, when you have MRCOG Part 1 email, you know,
Yes, ma'am.
that congratulations email which you get that you have passed, take a
Yes.
print out of that, get it attested. When you're doing the attestation of primary medical degree, same person can attest this. You
So
can
the
show
doctor or consultant can attest it
generally it
because
should be lawyer attestation.
lawyer.
Yeah, yeah.
Okay.
So Parna,
Okay.
in the Saudi students, they go to one attestation center. I'll ask them and I'll send you the link.
Okay, ma'am.
But there are some attestation centers, you know, some that where they're actually doing it. They're putting the stamp, which are by government. They're there, right? So every
Okay.
country has got attestation. Experience should be with you, and that would be in the blocks. Sarah? Like it's written that, okay, this date to this date you have done in this hospital, there would be a figured where it would be like there you're going to add on. When the application opens up, it's written there. You have to do that. So it can be exactly Sophia Huck. Anybody who is gazetted can do that, Sophia. All right, okay. Now, if with regards to the documents, you guys should be ready with the documents in 1 month time so that there's no difficulty. Now, if you ask me, RCPI is not an exam to get failed, especially when you have taken other exams. But still, if you have mindset issue, no, I will start it late. All right, just one question by Simon Ajim. My name is different on my degree as after marriage, my surname is changed. Is there any additional document needed? If your degree's name is different to that of your RCPI name, then one thing is that you have to give that change of name document attached so that they don't have any confusion, Simon. All right. That is as per, if it is attested, then of course they are responsible for the attestation. The one who is attesting would definitely verify that, right? Okay. So in RCOG, it's a big trouble for the Pearson centers. But for RCPI also, you should have your hands on to the change of name documentation. All right. The ones who fail in RCPI are the ones either who are shaky, who are starting late, or having non-focused preparation, who still don't understand that what is the RCPI preparation like. So from day one, I want you guys to be strong that we are taking September just to pass this exam. We don't have any other option. It is possible we would do that. Very clear time management. It's a very doable exam. Nothing is difficult. Nothing stretches you in RCPI, you know, but a very focused study, knowing that what has to be done, what has to be covered. When you'll attend my live sessions, you guys would understand that how it goes, how the things are, but a very targeted approach. That's the reason that we are starting early so that I get ample time for the fast track and the recalls with you guys as well. 80% of the exam now was also in the March was recalls. So I'm expecting the same pattern. You have the most important, as I told you, is Irish guideline. And every single Irish guideline should be on your tips. But you know, they don't give the lines question. They give you scenarios. Like clinical scenarios. So the data and the content would be, recommendation would be from the Irish guideline. But the idea behind that would be in terms of clinical scenario that you're able to pick up. Vaginal birth after cesarean section, the uterine rupture points are there, but they would start with 28 years old patient, para 2, she's gravid at 3, 2 previous cesarean sections now. You know, typical question of hematuria, bradycardia. So you pick it up that, okay, they're talking about the uterine rupture. What would be the steps? So we will make you practice that how your clinical acumen has to be stronger. After you do your all Irish guidelines perfectly, the remaining topics which are not in the Irish guideline have to be done by Green Talk guidelines. For FSRH, only summary is sufficient. In fact, my session is sufficient. NICE are only done for those which are actually not in other other topics done. So fasting effects, and we can't take strepsils even, yeah? All right. So then we have talks, and the talks are those parts where you just have to do last 3 years. And the last 3-year talk articles are those talk articles where summaries are given on your portal. And you just have to do those summaries, right? When we have the talk articles, which are very important, I will tell you in the live sessions that these talk articles are needed, must, and 100% question would come. So when we start one module, I tell you that this has to be done. This can be like 50% done, and this can be ignored. So my session would be the guidance of giving priority to the topics. And you'll understand what you have to do good and what you can just ignore. Now we have so many questions for the Mrcpi that we practice from the books. Unfortunately, we do not have the RCPI book separately. So what you have to do is that all the single best answers books, they are given, and we started in the open group as well. You do those open books. I'm sure that you guys have started discussing those books from we do, but few of the guidelines which have got different recommendations like growth restriction, like NTD, then you mark those questions. Take a highlighter, right, Simon? So Bia, take a highlighter. That this pink highlighter I'm taking up from these books, marking that out of Amanda Jones, these 20 questions out of 100 are different, right? That these questions answers are going to be different as per RCPI. This is how you do your books ready. It won't be too much, but like 20% of the books might vary, especially the topics which I'll tell you they have different, especially subfertility is now different. Chickenpox has got differences. So no need to do EMQs. EMQs I tell only when your single best answers are done to practice more. But the content of the single best answers from these books, and we will practice all the books in the open group. Everything would be done. Clear? It would be done for everybody. You will go through the study group. The moderators are there. They are RCPI. They would guide you that this thing is there. If any question is there, and at the end, if you feel that something you want to improve, I'm all there to add on the content to you guys. But course itself is sufficient. After every session, you will have a mock exam of that module in which we have added typical exam questions. So that, for example, I start with gynec, I start with early pregnancy, you will understand that, okay, what questions are coming up. So self-assessment will go side by side, please. The ones who are joined for the from the open group, please, this is the link, and who are messaging me to join, please put in the coupon RFA limited offer that's going to reduce 200 the fee, and then do the checkout. If you want to do books from the RFA past papers side by side, you can subscribe to this book now, or even with the fast track you guys can do after your theory becomes stronger. All the live sessions are by me. And just in April and May, because of the mock exams, I'm packed. But after that, till September, I'm going to be with you guys back to back. Did you guys get the live session schedule, everybody? All of you, did you guys get the live session schedule in the group? You have the live session schedule with you? Suparna, Bintava posted in the group or no?
I did not check, ma'am.
Okay, all of you, please, you have it? Please open the Telegram group. The live session schedule is with you guys. A little change might happen in these days, especially 20th. It is just the UK mock exam would be closer, but this would be the sequence generally we'll follow. If I will change one of the session, that would be postponed, but how do I make the schedule? The schedule is made in a way, all of you please understand, after my introduction, you guys will start the gynecology study. And when you have the gynecology study, in between this part, you will prepare all the gynae topics. Then you will meet me in the live session. So the daily schedule given to you would be in a way. If at all, because of some mock exams or something, the schedule, live session schedule I postpone, then you will continue with that module and you will start the next module and I will give you the date. It's only for like 1 or 2 during the mock exams, that's it. This time, I am trying to complete the regular course till June because I really want that in the July, August, we have good thorough recall practice, right? So till June, if you guys complete the regular course and you will start all the recalls with me from 8th of July, we will start doing the recalls, all the past paper questions. It would be a good reinforcement with the revision of the older one, right? This is the most important thing and idea. All of you have the daily schedule with you guys? All of you have the daily schedule with you guys in the group? That what you have to do daily, the topics?
No, there is the topics I have. I don't know. I don't have, I think.
Okay, no problem at all.
Can
Saima says it's there, right? Okay, no problem at all. You should know from tomorrow what topic you guys have to do, and daily discussion of that topic would be done in the group, in the Telegram group. You can read on your own, and the resources will be shared in the group. You're going to do only those resources and the summary from the portal, right? Did you guys get it? Yes? It's very important that from day one that you are on the right direction. We are starting again early. I don't want to bombard you guys with so many topics like, one topic a day is not a problem, but we should do it. But whatever you're doing the daily topic, it should be on your tips. Please don't make it pending. Because if you'll make today's topic pending, of course, the second, third topic will get piled up. Now, I know Eid is coming and maybe 2-3 days of Eid, you're not able to study because of family commitments. I want you guys to do it early. Plan it now. Like we are going to cover it early rather than, making it pending. Those 1 topic, 2 topics, 3 topics of that Eid days, you can do it early. Do you guys get what I mean? That is the reason of giving a daily schedule and the live session schedule and the book schedule. So you exactly can plan your commitments according to that. Right? Any questions? I intended to do a topic as well, reduce fetal movement. But seeing that I know that intro has got longer, I will definitely do that in antenatal care. It was just a glimpse for you guys that, how do we learn? But would do that in the topic of the antenatal care. It was a new guideline. But because we have taken a longer time for the intro, I'm sure that you guys have understood the topics, study pattern. If any question is there, please, I'm here to address, I'm here to answer. We are going to start from the first module. You will be opening up the gynae topics just from tomorrow, and you will be starting up, please. Any questions, anything which is not clear for the introduction, from preparation of the documents, from how to study, what will be the format, I'm here to answer, so that after this, I just need one thing in mind, that we will work hard and we'll make it a success. And highest scores ever by the students, please. So you don't have to miss that out, please. I'm here for the questions if anything is there. Saima, Claire, Sobia, Swag, Peter, are you there? Understood? Any question, Peter? All of you have seen the website. So I need, depending upon that, how much is your speed? I need 1 topic to be done daily. Now, if that topic takes 2 to 3 hours, do it. But if that topic you can do in 1 hour because you've already prepared that, even then it's perfect. Okay? Got it? So I think 2.5 hours have to be minimum study now. You have to follow the premium Telegram group and the open Telegram group. Open Telegram group for the books discussion, premium Telegram group for the daily discussion, daily topic discussion. All right, you can open up the mics if any question is there, please. Yeah. Yes, please. Any other question? Anything which is not clear? Sarah, anything in your mind?
yes, Doctora.
Yes, Mariam.
From the start of Ramadan and every day in the open group, they are setting 1 topic discussion. This one's the same topics or started a new
So
schedule.
the daily schedule will be according to the modules. Now the gynac will start after you complete your first read. So gynae topics will start and they will post it just now. I'll
From
just tell
tomorrow,
them to post it in the
from
group now.
tomorrow, from tomorrow they will
I
start.
will post in the group and see the date as well, my dear. I'm
Oh.
telling the moderator, she will be posting in the group. Okay?
Okay.
Daily schedule.
So this daily schedule is different from the one which we are already doing, no, ma'am? Already daily sessions and question
You're not
answers.
doing the gynae module now, right, Suparna?
No, no, ma'am. So that will be on another.
Yes, that will be now started with comparison to the live session, you know.
So it will be another group or the same group?
No, same premium group, March 25.
Okay, ma'am.
March 25 as per live sessions. Okay, yeah, I've posted that and the moderator is going to post that. Okay, all right. Any other question in your mind, please? Now keep on stay in contact with me. You all know my number. This is my number. This is the website number. If you have any concerns regarding the website access, the second number is there. And this first one is my number. If you feel that anything is not understood, if you feel that you guys are not understanding anything, please do your self-assessment after each module. I don't want anything pending. You should be able to comprehend and do everything. And make sure that the September exam is a success, right? Practicing questions side by side. The idea behind that is that we don't miss out. We just don't do the theory only and we go to the questions side by side. All right. Okay. Any other thing which I can help you with, please? Yes. Anything in your mind? I'm happy to answer. Done? All right. I will just tell. Yes. She's posting, please, and the daily schedule. All right. Thank you very much. I'm grateful for waking up early in the morning, but it was just that I had OSCE session at after Iftar. So I thought that I'll meet you guys. But then I thought, okay, I'll delay introduction after Eid. But again, it was in my mind that earlier the better. So at least you guys are so clear about what we are going to do, how we are going to prepare. And that throttle comes up after meeting only. Am I right? So who is going to pass this exam in September? Yes? Who is the one who would be passing this exam in
Me.
September? Can I have the thumbs up, please? So
Me.
100%, 100%. Mariam is going to pass, inshallah. Peter, you have to make me proud. Yes, you promised me on the first phone call. Guess what? I will stand beside you all together in this journey. After the live session, you people will feel a change in the approach towards the guideline. Only I need few days for settling up Mrcpi Part 3 till this May exam. And after that, you guys are priorities. It's going to be your exam, but moderators will be there. They will be assigning the task. Nothing will be pending. If still anything you feel that has to be improved, immediately just drop in a message to me so that it comes in my notice. Eventually, it is my responsibility. Everyone and lots of students from your references are messaging. Please give them the coupon. I know that it's just the word of mouth how the Illumini works and you all join. But at the end of the day, I'm a very, very tiny, humble creature. We'll put in hard work, we'll put in efforts and make it a success. Literally, college wants you to pass until unless you force them to, fail you. I say that in OSCE as well. I say that in written as well. You all can do it. It's a doable exam. And it's a very easy one if you start from day one. Don't make it a burden on you. Start loving it. Start doing the comparison of Irish. Start being as a family. Be in the group, like helping each other. You guys would see the change gradually in your approach towards exam. Thank you very much. I'm so grateful. Thank you very much. Very, very happy last blessed days of Ramadan to you guys. Remember in prayers in all the nights, please. And may you all enjoy the Eid days with your families. May all the health and may all the blessings be with you guys. And we are going to meet in the study groups according to the schedule. Start working from today. Everything would be fine. Thank you so much. Best of luck from the entire team of Mrcpi tutors. Thank you. The recording would go upload on your portal as well. It would be on the YouTube as well. For the live sessions recording would be uploaded on your portal and you can listen to it as many times as you want. Yes, please. Somebody was saying something? Thank you very much, Saima. Thank you very much. All right, guys, take very good care. Thank you very much. Bye-bye, everybody. Thank you so much. Bye-bye. Take care.
Ma'am, thank you so much.
Thank you very much. Thank you. Bye-bye.